get so much from our patients. We get so much from the families that it's easier to see when you do that day in and day out. Like you said, it is a calling, and I think when our patients and families get to experience the care of our staff, they experience the compassion that they have, and through that, we're able to provide some comfort to those patients and families.
If we repeatedly hear one thing, it's, I wish I would have got hospice involved sooner.
Hi there, welcome to another episode of This Day and Age, where we bring together experts in all things aging from Holland Home, Faith Hospice, and Atrio Home Care. I'm Phil Tower. We remind you this podcast, This Day and Age, is all about giving you important information needed to help you and your loved ones make important decisions and make confident decisions while navigating life journey. This whole thing called life can be a little difficult, a little challenging, but it's a lot easier when you make confident, informed decisions. And in this episode, we're going to talk about hospice care. There are probably few things in life that are as confusing or misunderstood, or maybe at least in some cases feared. And they hear that term hospice care. It is a stressful, emotional, and overwhelming time. And perhaps the hardest step is, what do we do now as a family? Where do I go from this decision? As a patient, who do I talk to? How do I get started? So in this episode of This Day and Age, our goal is to educate you, to inform you, to make those confident decisions, and to know what can be expected, and to really make this journey for a family or for a hospice patient as easy as possible, as informed as possible. And boy, do I have the best people with me for that conversation. No pressure, you guys. Tammy Sue Veldkamp is Executive Director of Faith Hospice, as well as Ben Jacobs, Director of Operations at Faith Hospice. Ben, welcome. Tammy Sue, welcome.
Thank you.
Yeah, thanks for having us.
I am so glad that we can have this conversation. Hospice care can be confusing, but at the same time, it is a gift. It really is. And I think a lot of people fail to recognize this. But let's start with the decision itself. It can be confusing, and often it happens when someone has received a diagnosis or has been on a cancer journey or some kind of a serious health condition that has deteriorated to the point where the doctor says, hey, you're facing probably a limited amount of time. So let's talk about how that process happens. And Tammy Sue, I'll start with you. How do most people get into this conversation?
Well, I would say mostly a physician would recommend hospice. And I think anytime I've talked to families about hospice, a big piece is just acknowledging the weight of that decision and hearing that news. It's very emotionally fraught. Not just the diagnosis itself, but reaching that hospice decision. So usually a physician might recommend that, whether what treatment is recommended you do not want to receive, or what treatment you've been getting is now not working. And so the next step is comfort care. So physicians are very good, providers are very good at suggestions on who to consult. Family members, friends who have had experiences are good with that as well. But I most want families to know that they can call and just get information. We can meet with you and talk to you about what hospice does and what it looks like and how it can help you. We do what we do because we want to help. We are not high pressure salesmen.
Yeah.
At all. I mean, if
No.
if you're not ready, we don't want you on hospice. Yeah. But we love to talk about how we can help, how we can make the journey the best possible for you. So there's no commitment to sign up. You can call and even not give your name and just ask for information. So,
it's funny you said that, because I was going to ask that question. Do you ever have people call proactively saying, my dad is 86. I'm a little nervous. I'm a little scared about this. It's kind of like the door you've never opened. You don't want to go behind that door, but once you open the door, see what's there, it's like, oh, okay. Being informed, making confident decisions, as we said in the beginning of this conversation. I would think that probably is empowering for some people, some families, right, Ben?
Yeah, for sure. And I think we will get a lot of those referrals from families that are a bit uncertain. They say, yeah, I'm not sure if we're quite there yet. And that there yet, sometimes that means something different to somebody else. You think of hospice care, well, I don't think mom has a week or two left yet, but why don't we, get a hold of hospice? Well, the hospice benefit's a lot longer than a week or two. So it's great to start with one of those referrals, get some information about hospice, and they might be surprised to find that, no, maybe mom doesn't have just a week or two. Maybe she's got longer than that, but she still qualifies for hospice now. So they might be able to benefit from that service long before they thought that they could.
Tammy Sue Veldkamp, as Executive Director of Faith Hospice, what are some of the most common misunderstandings you hear from families and from patients? I think people don't really understand that word hospice all the way, do they?
Yeah. Well, I think a very common one is that hospice is one thing. That there aren't different options for hospice. So hospice is a philosophy of care, but once it became a Medicare benefit, then there were also a lot of companies that came about to administer that benefit or serve with it. So you have different choices of hospices. There's profit, nonprofit, some that have faith backgrounds, some national hospices, local hospices. That's probably the most common one I hear repeatedly when we talk to people. The other is thinking that you wouldn't call a hospice in until you only had a day or two, or been mentioned a week or two.
Right.
And that's not the case. If we repeatedly hear one thing, it's, I wish I would have got hospice involved sooner. It's hard to hear or think that at the beginning, but when you realize the team that can come around and support you, and the physicians are very knowledgeable in comfort care and helping with quality of life and symptoms, so that a lot of those things are controlled so that they're able to really benefit from the last days that they have of life and feel better.
I'm so glad you said that, because this is, hospice care under Faith Hospice is not just one person in a room with a dying person. It's so much more. It's a multidisciplinary approach. You've got a great team, which we're going to get into, but in terms of that choice, you led right into that, which I'm so grateful for. There are a lot of choices out there. I will tell you, anecdotally, and we're all getting older, and I think this conversation happens a lot more. There used to be maybe a little bit more of an apprehension about it, but as we get older and our parents and loved ones or grandparents are dealing with that end of life process, it does happen a lot more. And I have heard so many positive things about Faith Hospice. Just, and that word of mouth referral, like you said, is really big. But let's talk about the decision, the things you should look for. Tammy Sue Veldkamp, help us understand that. What kinds of things, what kinds of questions should be asked in that process of choosing a hospice provider?
Yeah. So I talked about profit and nonprofit hospices. There are also national hospices and hospices that are local and faith-based. So Faith Hospice is faith-based. We wanted to reflect that well, and thus the name Faith Hospice, because we are associated with Holland Home. But they did do the name change quite a few years back to Faith Hospice, because we wanted to reflect that local faith-based care. Now that we are faith-based, but we serve out of that. So our goal is always to make people comfortable with the journey spiritually, physically, emotionally, where they're at. So our goal is not to convert anybody, because we all have different faiths and we're all at different parts of the journey.
That's a great point. I'm so glad you said that, because some people may have an apprehension about that when they see Faith Hospice. But you're absolutely right. Faith is just like end-of-life decisions. It's a very personal thing. It's a very powerful thing. That level of spirituality can be at different levels in all types of people, and that's a great thing. At the same time, beyond the faith aspect of it, which is arguably a very important point. I would think that most people want that aspect of spirituality, and from a Christian faith or other faith standpoint, that is important for the end of life journey. But beyond that, what other factors should be considered when you're making a hospice decision? Ben Jacobs, I'll turn to you for that one.
Yeah, I think something that a lot of families or prospective patients aren't aware of is that you can, I don't know, for a lack of a better way to put it, you can try on a hospice by asking for an evaluation and get to meet one of their nurses, or an informational visit, which is often done by one of the social workers. And they have a face-to-face conversation to ask them all sorts of questions, to get a feel about what hospice is in general, and then ask that question too, well, what's different about Faith Hospice specifically? And Tammy Sue did a great job of covering some of that, where we serve out of a specific mission and the values that we have. So you're able to have some of that conversation with somebody. I've worked in various settings in the medical field, and a lot of it has been with older adults. And one suggestion when they're looking at placement options, if somebody's at that stage in life, was go to the facility, go look at it, go talk to the people there. And I see a hospice informational visit with one of those staff people from the hospice as that. So it's not uncommon for us to have patients or their families to have met with 2 or 3 different hospices. And I think that's a great suggestion.
Mm-hmm. I'm so glad you said that. Ben Jacobs is Director of Operations for Faith Hospice. We're also with the Executive Director of Faith Hospice, Tammy Sue Veldkamp, on this episode of This Day and Age as we talk about the hospice journey. And probably the biggest question, we addressed this a little bit, is when to begin the journey. Typically, the doctor recommends that. Does it ever happen where a patient says, even though the doctor says it's time, but the patient says, I don't think so? And how do you navigate that disagreement or philosophical argument, if you will, Tammy Sue?
Mm-hmm. Well, it's always a patient choice. So they may emotionally not be ready for it. And I get that. It's tough. It's a tough point to reach. So when I would meet with families and there would be that discussion, I would talk about all the benefits that hospice brings, and the comfort, the medications, the supplies, somebody to call 24/7 because you need help. And it always happens that you need help on a Saturday at 2 a.m. in the morning, and so it's somebody to call for support. So there's all those benefits, but until you're ready emotionally, we'll be there. And like Ben said, they might meet a couple times with different hospices, but we have families meet with us 2 or 3 times before they're able to make that decision. So it's a personal one for sure.
And I would think sometimes you've got, adult children who are trying to convince mom or dad that, hey, mom and dad, the doctors really are good people we can trust. And yet mom and dad are saying no. And that social worker on the Faith Hospice team has got to be invaluable at that point, right? To have that conversation gently.
Oh, for sure. But
maybe repeatedly, or at least revisit it. Because a patient can change, Ben, from day to day, right?
Yep. Yeah, and I had probably hundreds of opportunities to meet with families and be that first point of contact at the patient's bedside or in their home. And sometimes there's apprehension there to make a decision like that. Sometimes on the patient's behalf, sometimes from the family. One thing that was comforting to a lot of patients or families was to say, well, one of your rights is that you can sign off of hospice if you don't like it. And that can really make somebody feel more comfortable to say, okay, you know what, let's try it for 3 weeks. Let's get a better understanding of what this is like. And if I don't like it, if it's not the direction that I want for my care, then we can sign off of hospice.
I bet a lot of people didn't know that. And what an empowering and also freeing thing to have in your mind, that if I don't like this process, I can opt out. Yet at the same time, if I get into it, as Tammy Sue, you said, some people go, why didn't I start this sooner. And we've heard that on some previous episodes of this podcast, this day and age, that a lot of these decisions in hindsight, would have been made sooner had there been that ability or that knowledge, if you will. Hospice care can happen in different places. Faith Hospice has, if you will, residential care. How would I describe that? What's the best way to say that?
Inpatient care at Trillium Woods.
At Trillium Woods.
Where you can just get physical care. Maybe the family can't do that or aren't available to do that 24/7 care, but it can also be for symptom control. So if we can't get somebody's symptom under control at home, then we might suggest that as an option to go there for that.
And then the other option, which is very common, which a lot of patients choose, is in home. Mm-hmm. And so that decision is patient-based most of the time, but as you said, sometimes maybe pain management, it's important to be inpatient at that point.
Yeah, but we do a lot at home. Most of our patients, and that's what hospice came about to be, is to support families at home. Most of us want to die at home, not in the hospital. And your family's more comfortable around you at home as well versus driving to and from the hospital. So we always talk about it's wherever you lay your head, whether it's under the bridge or it's in a hotel or an inpatient unit, long-term care facility, even in the hospital. We'll start patients on hospice in the hospital if they have a symptom out of control and they may be there to get care. So hospice goes everywhere.
But I'm so glad you said the Trillium Woods part because, Tammy Sue, there are a lot of people who don't have the ability to have, that piece of dying at home, or maybe they just don't want that. Mm-hmm. They don't have the care and the family built in. Maybe they're all alone, and that is really a gift to be at Trillium Woods. But at the same time, that in-home care, as you said, to have people there to be at peace in your own home, to be in familiar, comfortable setting, that is a really, really big deal. And to have, that assigned hospice nurse or social worker, that's really important. And that can kind of be a matchmaking thing as well, too. I see these wonderful billboards with the Faith Hospice workers on them throughout the greater Grand Rapids area, and I think about what a special gift it has to be a person in that role. I mean, a lot of people say this is the last thing I would want to do, but a lot of people feel called to do that. I mean, is that a special person?
Oh, yeah. I mean, absolutely. I always say when people hear that I do hospice, they look at me with awe and horror all at the same time. And
thank you for honestly answering that question.
But we do what we do because we want to help. I mean, almost all of us, I think all of us, have had a family member in hospice. So we know what that brings. And you do hospice because you feel led to do hospice. And we aren't machines by any means. We're people, and we want to help. And that's a big part of when people want to come work for Faith Hospice, we look for that hospice heart.
Absolutely. And Ben, you said you've been with hundreds of patients and families bedside through this whole journey. I'm thinking about both of you guys, the world of wisdom that you have gleaned from this process. People at the end of life have not only do you learn a lot, there's just a lot revealed, just some really powerful things that happen in family dynamics. And that's almost a gift that someone in this field has, to see that part of life, which is we're all going to be there, and to experience at that level. I mean, do you look at that as a benefit of your job in a way? I know that sounds weird to say.
No, yeah, doing it for as long as I have, it doesn't seem weird to me because I understand we get so much from our patients. We get so much from the families that it's easier to see when you do that day in and day out, why somebody might do that. Like you said, it is a calling. And I think when our patients and families get to experience the care of our staff, they experience the compassion that they have. Because you're working with folks who are facing the end of their life each and every day. 40 plus hours a week. And it does. It really, it normalizes it a little bit to a group that kind of specializes in that end-of-life care. And through that, we're able to provide some comfort to those patients and families.
That's Ben Jacobs. He's the Director of Operations for Faith Hospice. Also with us on this episode of This Day and Age is Tammy Sue Veldkamp. She is Executive Director at Faith Hospice. I want to go back to that hospice team, the Faith Hospice Care Team, and talk about that. It is a team of clinicians and support staff at a lot of different levels. Obviously, in a lot of cases, we think of the hospice nurse, but it's more than that, Tammy Sue. Can you kind of help us visualize that team?
Mm-hmm. We also have several physicians that our goal is for every hospice patient to be able to have an in-home visit from the physician. So a physician's part of that team. The nurse, a case manager is what they're called, is assigned to a patient, and they look at the overall picture and they help coordinate the other disciplines seeing a patient. There's a certified nursing assistant that assists with the physical care, and most of all these things but the nurse is optional. But so somebody may need that physical help, but they may not want it until later.
Right.
So then there's also a chaplain, and our chaplains help with the spiritual and aspect, and a social worker, of course. Ben's a social worker by background, so he could address that better, but social workers help with emotional support, helping to be sure that paperwork is in place, that arrangements are made, and some counseling as well with the family. And then we have a large group of volunteers too. Not to mention then there's a whole bereavement department that helps families afterwards as well.
Yeah, which is really, really important. And I've got a question about that, but Ben, that social work aspect of this may be at points more important than the nurse or the doctor. Yet at the same time, one of the questions, I think one of the fears, as you said, the horror when people find out that Tammy Sue is Executive Director of Faith Hospice, but I think really a lot of people are afraid of pain at the end of life. If they're dying from cancer or some other disease, they're afraid of the pain making that end-of-life journey less than pleasurable, but we have come a long way in making the quality of life at end of life a lot better. In fact, Dr. Dozman, who is a part of the Faith Hospice team, we had a wonderful conversation with him about pain management. Do you get asked that question about will mom or dad suffer and how can we monitor that? Because I would think the level of care changes, obviously, in the journey, right, Tammy Sue?
Mm-hmm. It's a constant discussion and a fine line to walk, because you want to be comfortable and yet you also want to live life. I mean, that's the point.
You don't want to be comatose.
Right. And our patients are living. They're not dead yet, or they wouldn't have our need. So so our patients are living, so there's a line you walk of comfort and yet being able to function and interact with your world and with your family. We have so many tools available to us now that we didn't before. So many avenues to come at pain, both on an anxiety, emotional level, but the physical, neurological level as well. And our doctors, they're palliative, they're board certified with palliative and hospice care, and they're experts in their field, and they know what they're doing and have lots of options. And that's a big fear. And I think now, in the culture and the day and age that we live in, we can make an assumption that that's not going to be a problem. I'm going to assume I'm going to be comfortable. So what are the other things you can provide me through social work and emotional support? Okay.
And a sense of humor throughout the journey doesn't hurt.
Right.
Yeah.
Right. I was going to say, I laughed when you said, I'm not dead yet. It reminded me of a Willie Nelson song. We all remember Willie Nelson. Every year or so, there's a tweet that says Willie Nelson died. And he's still, so he actually wrote a song that woke up still not dead today. And I thought, that sense of humor for the Faith Hospice team, for the patient to have that's a big plus. Not everybody does, but when they do, it's a plus. To enjoy that journey, to understand that every aspect of care is going to be managed. I can't tell you. I feel more empowered just having this conversation. But let's talk about after our family member, our loved one passes. Faith Hospice doesn't just say, see ya, walk out the door. I mean, bereavement, grieving is probably one of the most mysterious of all human conditions, Ben. I see you nodding your head. We don't fully understand it, even all the great knowledge and wisdom and the studies that have been done by it. The journey is different for everyone. How does hospice play a role in that bereavement and that grieving process?
Yeah, so, we address it in a couple of different ways. I'd say there's something called anticipatory grief. And a lot of times our social workers, while the patient's still living, is able to work with the family as they anticipate that grief of loss before the loss actually occurs. Yeah. And so there's a huge advantage to have somebody trained and who specializes in that to help talk through and process some of that while you're on that journey with your loved one still. But then you specifically mentioned the bereavement support, which we think of as after the patient passes away, which that was always another piece of hospice that I enjoyed sharing with families when talking to them about what hospice offers is after your loved one passes away, hospice, there's still a benefit there for you, for family, even close friends, to reach out to hospice. To say, I'm really struggling with this. I don't know if I'm struggling in a normal way or if this is not normal. And we've got people who, again, specialize in helping people through that process, through that journey. We talk about it being a journey, and it is. It's a lifelong journey.
And sometimes it may be the first thing you hear for a month is, I'm fine, Ben. I'm fine. We're fine. Family's doing great. And then a month later, a wall hits. And you guys, I'm sure, have seen this. What are the resources I know you guys do so many things at such a great level for families. What are the resources, especially after mom or dad have passed or a loved one has passed? What else is out there? I would think support groups are huge.
Yeah, support groups are huge. Our bereavement group, not everybody feels comfortable reaching out.
Sure.
So our bereavement group has different times where they'll actually reach out to some of the family and just check in and give them an opportunity to say, yeah, I'm really not doing that well. I thought I was. They send out mailings. So even if somebody doesn't feel comfortable, giving us a call or talking to somebody on the phone, they'll continue to send out mailings over the course of about a year, just describing what grief is, what's normal, and then also letting families know what might not be normal and what might be something that you'd want to reach out for some extra help, some extra support on. So they're doing that through about a 12-month period, sending families some resources on that.
Wow, that's tremendous. And that has got to be really reassuring because, as I said earlier, everybody begins that process differently, and I think there is a lot of normal denial. Part of that is just the emotion and just the pace of dealing with a funeral and visitations and constant visitors, and just life has been disrupted beyond the passing of a loved one. But that is really reassuring to have that and to know it's there for that period of time. That is really, really good to know. I think most importantly, as we said in the very beginning, if you have questions, you've listened to this episode, pick up the phone and call. Ask for a visit. You can visit the facilities. You can sit down with a social worker. You probably, as executive director of Faith Hospice, Tammy Sue Veldkamp, you probably sit down with people a lot in this journey, don't you?
Well, and I definitely have over the years. And people that we personally interact with in our churches, they'll ask us questions, and I'll just talk to them one-on-one about what's going on and what will meet their needs. Because it's a journey, and it's different for everybody, and everybody reacts differently to it as well.
And that's not something that we mentioned earlier, too, when you say, well, how do you find out more about hospice? We also go and speak to groups of people. So if you're part of a community, whether that's a church or a nursing facility or any other kind of long-term care facility, and you've got this group of people that are thinking, I'm getting older, or man, my parents are getting older. I wonder if it'd be good to learn some about some of this ahead of time.
You know, that I am so glad you mentioned that. A church, a senior living facility, any of those places, even, even a group of families in a neighborhood who said, hey, we were all together, we all asked this question, so let's do this. Faith Hospice will be there to answer those questions for you and ask early, and know that they are there and armed with the information you need. Remember, that information leads to more confident decisions at the end. You guys are so good at this, and I feel incredibly informed, so grateful for this opportunity to have the conversation. Tammy Sue Veldkamp, Executive Director at Faith Hospice, and Ben Jacobs, Director of Operations with Faith Hospice. I want to say thank you to both of you. Thanks, Ben. Thanks, Tammy Sue.
Thanks for having us.
Yeah, thank you.
So hopefully you have all the answers. You might not. So if you're still looking for answers, I have a couple of questions after you've heard this episode, or maybe have a loved one who's at that point where you think you might need hospice care. Faith Hospice is always there to help. And I think we have set the stage for you to feel more comfortable about making that phone call. And remember, a phone call is not a commitment to start services. You're just there to ask questions, and Faith Hospice is there to answer those for you. So give them a call. They'd be happy to talk to you. Faith Hospice number is 616-235-5113. I'll give that to you again, 616-235-5113. Of course, Faith Hospice is online. They have a terrific website at faithhospicecare.org, faithhospicecare.org. Lots of questions answered there as well, but not as good as this podcast. And for this day and age, I'm Phil Tower. Thank you for listening.